whole planet is at stake. The way we have been moving leads nowhere, and that we need to change course.
We need to reduce global emissions by 50% by 2030. This cannot go on. You know it, I know it, and we know what we need to do.
Poverty is not natural. It is man-made, so poverty is not inevitable.
We have an enormous potential of what children can achieve together if we let them.
All people are entitled to the same respect, justice, and human rights. And yet across the globe, this struggle is still being fought. Inequality for women is one of the world's great injustices, and it must be and will be swept away.
We are bringing young people to the table now, not as a token, but to take that baton, to take up the gauntlet, and to move forward.
Strength, power, and courage was born.
The passion for protest can turn into a passion for changing all of our behavior to create a better, safer, just, sustainable world.
It's a myth that each and every one of us doesn't have the ability to change the world dramatically and quickly. There is power in every decision we make.
People have shown an enormous capacity to adapt to new circumstances, an enormous capacity to change.
In the 75 years since the United Nations was founded, the human race has never had to face a set of challenges like we do right now. But together, we can overcome them. Nelson Mandela said, "It always seems impossible until it's done." These are some of the things that must be done.
A quote always worth repeating: it always seems impossible until it's done. South Africa's first democratically elected President, Nelson Mandela. Ladies and gentlemen, as we just saw, our world is at a critical juncture, with COVID-19 compounding a long list of global challenges. Over the next 3 hours, we will hear more about this moment in history and the bold choices required to deliver the SDGs by 2030 and the rights and wrongs in our world, looking in particular at issues of poverty and inequality, climate action, and gender equality. These three prisms offer an integrating thread across the 17 goals and are a fitting entry point for and to the decade of action. To begin, we will hear from the Secretary General, a leader who has helped deliver ambitious change in countless roles, as Prime Minister, as UN Refugees Chief, and now at the helm of the United Nations. He is to my left. Mr. Secretary General, you have the floor.
Excellencies, ladies and gentlemen, all protocol observed. I'm pleased to welcome you to this SDG moment, the first in this crucial decade of action to achieve the Sustainable Development Goals by 2030. Our aim is to show that transformation is possible and is happening right now in so many places, with so many innovations, and with the engagement of so many people. This annual SDG moment is our opportunity to demonstrate that, as one united family of nations, we have what it takes to eradicate poverty and hunger, tackle climate change, deliver gender equality, and achieve all 17 global goals. And through the Nations United film that will be broadcasted tomorrow, we will bring this message to the entire world. We can make tremendous progress over the coming decade, especially for the most vulnerable and the poorest of the poor. When the public appetite for change is matched with political will and smart policy choices, rapid progress is unstoppable. But our task is daunting. The foundations of our world have been shaken to the core by COVID-19. The pandemic has pushed us towards the worst recession in decades, with terrible consequences for the most vulnerable. Societies and citizens are reeling from widespread disruption. After many years of progress, poverty and hunger are on the rise. Children are suffering from a lack of schooling. Debt is skyrocketing. Fiscal resources are plunging. And even before the virus, inequalities were growing. The benefits of globalization and growth had failed to reach millions upon millions of destitute people, deepening their already profound despair. Biodiversity was also disappearing, and greenhouse gases were at record levels. We need a path that brings health to all, revives economies, brings people in from the margins of society, and builds long-term resilience, sustainability, opportunity, and peace. Excellencies, that path exists. The 2030 Agenda for Sustainable Development is designed to address the very fragilities and shortcomings that the pandemic has exposed. And at its heart, there is a simple promise: to end poverty and to leave no one behind. Indeed, the poor have a special claim on our efforts and energies. Those most in need are often those hardest to reach and must be reached first. That means expanding social protection and ensuring universal access to essential services. It means strengthening critical infrastructure like education, health systems, and internet connectivity. And it means placing women at the center of decision-making. The 2030 Agenda also demands a swift and just transition to inclusive, low-carbon, resilient economies. This green transition can deliver more and better jobs and a cleaner environment. It will reduce the risk of future pandemics and mitigate the worst effects of climate change. In short, the 2030 Agenda provides the guiding light we need to end the pandemic, to respond to its socio-economic impacts, and to chart a course for a transformative recovery. Excellencies, public appetite for transformative change is growing. We see it in the leadership of young climate activists and in the global movements for racial justice. We see it in the millions saying no to violence and discrimination against women, no to inequality, no to corruption, and no to political repression. We are also seeing key stakeholders using their power for change. We see it in those who are committed to the global search for a universally accessible vaccine for COVID-19. And we see it in the fact that renewable energy is now more affordable than fossil fuels. More and more businesses are embracing the social, environmental, and financial triple bottom line. Cities and subnational governments are developing new models for how we live, work, and grow food, how we reduce greenhouse gas emissions, and how we embrace social diversity. But there is no escaping the fact that one critical ingredient is still missing: political will. Without it, neither public appetite nor stakeholder action will be sufficient. Excellencies, the science is clear. The people are clear. There is no time to procrastinate. The decisions taken over the next few months and years will have enormous impact on where we will be by 2030. 3 areas are particularly crucial: finance, COVID-19 recovery, and ambition. First, financing. Right now, developing countries face the dual challenges of funding the pandemic response and avoiding a major debt crisis. For the Sustainable Development Goals to stand a chance, we must address the immediate, medium, and long-term financing challenges that developing countries face. Our leaders' meeting on financing on 29th of September is an opportunity to get behind the most significant policy options. These include boosting the resources available to international financial institutions and extending the debt service suspension initiative to at least the end of 2021. And this must also entail a broadening of the initiative's scope to all vulnerable, developing and middle-income countries, such as small island developing states, as well as comprehensive debt relief for countries in need. The second priority is inclusive and green COVID-19 recovery plans. Done right, these plans can help countries to transition to a more inclusive, equitable, and sustainable economy. As we spend huge amounts of money to recover from the coronavirus, we must deliver new jobs and businesses through a clean, green transition. And that means ensuring that taxpayers' money is used for a resilient, inclusive, and sustainable recovery. It means ending fossil fuel subsidies, making polluters pay for their pollution, and ensuring that no new coal-fired power plants are built. And it means reducing inequalities and placing women, who have been among the worst affected by job losses and increased care burdens, at the center of recovery plans. Women's leadership and equal representation makes institutions and policy decisions more effective and decreases inequalities in outcomes. This has never been more important. The third priority is ambition. We need ambition and solidarity to provide the $35 billion extra needed so that COVID-19 vaccines and treatments are available to everyone fast. Ambition to cut carbon emissions by half in the next decade, paving the way to carbon neutrality by 2050. And ambition to protect biodiversity, achieve gender equality, end poverty and hunger, and fulfill the promise of the Sustainable Development Goals. Excellencies, in the midst of the greatest international crisis of their time, the founders of the United Nations raised their eyes above the horizon and planned a better, safer future. The COVID-19 pandemic, the greatest challenge faced by us since the founding of the United Nations, has brought us low. But we will not be beaten. We too must look beyond the current crisis and set our sights high as we strike out for a world of dignity and opportunity for all on a healthy planet. Together, let us make this a decade of action, a decade of ambition, a decade of transformation, a decade of hope and peace. Thank you.
Thank you, Secretary General. The blueprint for recovery clearly is very clear. One critical ingredient that is missing: political will. Thank you for that, SG. The COVID-19 pandemic continues to rage in many parts of the world, and without the commitment and courage of frontline workers, nurses, carers, doctors, police, bus drivers, delivery drivers, cleaning staff, farmers, and more, the impacts would be much greater. So at the beginning of the decade of action, when we need to take action by everyone, everywhere, it is important that we take a moment to appreciate those everyday heroes. We will hear now from one of those heroes, Dr. Noah Biran, who was working in Hackensack University Medical Center, New Jersey, among the worst affected regions in the world by COVID-19.
Good morning. Thank you very much. On behalf of my colleagues, thank you for the opportunity to speak and to honor those who have died from COVID-19. In late February, I received a call from a physician colleague in Northern Italy. He called to beg for ventilators and other respiratory devices. He sounded desperate. He explained that hospitals were running out of both equipment and time. Several weeks later, as I walked through my own hospital's emergency room for the first time since the pandemic hit the New York area, I could hear my Italian friend's voice in my head, and I understood his desperation. Patients were dying around me. People were struggling to breathe, alone in rooms, isolated from loved ones, while staff, fully covered in PPE, were sweating as they worked without food or water from dawn until dusk. In a matter of days, entire hospital systems like my own had to be redesigned. Cafeterias were closed to accommodate intensive care unit beds. Jobs were changed. Gastroenterologists became anesthesiologists. Pediatricians had to take care of elderly patients, and nurses and staff, including those who were pregnant or had underlying medical problems, came to work, sacrificed their own safety for others. With gratitude, we accepted immense and generous support and donations from our community. But what about patients? As an oncologist, I know that cancer does not stop for COVID-19. My patients, often with a weakened immune system, were afraid to come in and receive their treatment. Unfortunately, I still see the ramifications from this pause in care. Many of my patients now have a worse prognosis. because their cancer treatment was delayed or their cancer progressed while treatment was paused. Sadly, these outcomes seem to be more pronounced among minorities and those of less means. And as the fight for COVID-19 continues, we grieve with the families whose mother, father, sister, brother, or child have died. COVID-19 has taken over 950,000 lives. The memory of these people will never be forgotten, and their legacy motivates us to keep up the fight. While there is still a long road ahead, we have learned much about the virus, its course, patients at higher risk of morbidity and mortality, and effective therapies. We've proven to be resilient, resourceful, empathic, and to stand for one another in support. These are proving times, and by standing together, we can overcome this crisis. Just as I have seen my patients and colleagues rise to the challenge, I am optimistic that we as a society can do so as well. Thank you very much.
Thank you to Dr. Noah Biran. Our next speaker embodies much of what is needed of the world as we seek to deliver the transformation called for by the Secretary General. In 2013, her life was almost ended because she stood up for girls' rights to education. Her defiance and her resilience inspired the entire world. In 2015, right here in the United Nations, she challenged world leaders to stand up for the rights of people like her and to deliver on the promise of the 2030 Agenda. 5 years later, she is back to deliver the people's address of the 2020 SDG Moment. Ms. Malala Yousafzai, the floor is yours.